Diabetes is a disease that may affect anyone. According to WHO, about 422 million people worldwide are living with diabetes, and numbers are constantly increasing. Disclaimer: this video is for only educational purposes and is in no way an alternative to a professional medical advice. Is cinnamon really a solution for diabetes? Let's find out in the video, but before that, let's see what's diabetes in a nutshell. Diabetes is a chronic disease caused by the body's inability to produce insulin or use it effectively. Insulin is a hormone made by pancreas. Insulin acts as a key that opens the cell's doors so that the glucose present in the blood can enter them and produce energy. Without insulin, the level of glucose in the blood increases, causing damage throughout the body. With age, diabetes causes many complications like kidney failure, blindness, severe infections and wounds, and even heart attacks. Generally speaking, there are two types of diabetes: Type 1 and Type 2. In Type 1, body produces no or very little insulin. The disease affects 5% of the adult population. Type 2 diabetes or Type 2 diabetes, also known as diabetes mellitus, generally appears around the age of 50, but can also appear earlier. It results from an exhaustion of the pancreas, which no longer provides enough insulin. It is estimated that 90% of diabetics are Type 2. 80% of Type 2 diabetes can be prevented or controlled through a healthy diet and regular exercise. Let's see if cinnamon bark is helpful to balance our blood sugar levels. With the scientific name Cinnamomum verum, cinnamon has been used since the dawn of time in India and Sri Lanka, where it originated. There are several species, including Chinese cinnamon, also known as Cinnamomum cassia, but the best known is Ceylon cinnamon. Its traditional use has crossed the continents, and its use against colds, flu, and digestive disorders is still valid. Cinnamon bark is rich in essential oil, including 63 to 76% cinnamaldehydes, also called aromatic aldehydes, and 4 to 10% phenols. It also contains tannins, coumarins, mucilages, and proanthocyanins, which give it certain antioxidant properties, protecting blood cells and lipids against oxidative stress. Now, let's learn about some therapeutic properties of cinnamon for diabetes. Cinnamon helps maintain normal blood sugar levels. Supplementation with cinnamon bark allows blood cells to better use insulin and thus improves blood sugar regulation. Several recent studies indicate that cinnamon compounds exhibit insulin-like properties. Cinnamon is thus beneficial in the fight against Type 2 diabetes. Daily consumption of 1 gram to 6 gram of ground cinnamon for 40 days, or about 300 milligrams of a cinnamon extract for 4 months, resulted in a significant decrease in blood glucose and certain blood lipids in people with Type 2 diabetes. Other benefits of cinnamon include: this plant increases the secretion of gastric juice and stimulates all digestive functions. The European Scientific Cooperative, ISCOP, on phytotherapy recommends cinnamon in case of flatulence, bloating, digestive pain, inappetence, and diarrhea. Thank you. Please consider subscribing if you liked the video.